As flames from the Eaton fire engulfed parts of Pasadena, over 1,400 nursing home residents had to be evacuated. These were people who relied on constant care, many in wheelchairs with oxygen tanks, catheters, or feeding tubes. LA does require that these facilities have an emergency plan in place, but the emergency plans tended to involve evacuating residents to another facility that was also being evacuated. So they wound up at public evacuation shelters. But when they arrived at those evacuation shelters, there were no medical supplies, no gloves, and not enough cots. People were simply dropped in the hallways and left waiting for hours without basic care, turning an already terrifying situation into a nightmare for some of the county's most vulnerable people. Advocates have been warning for years that nursing homes don't have proper emergency plans. Medical staff and volunteers did everything that they could, but the shelters were not equipped to handle these types of needs. We need real emergency plans for long-term care facilities to make sure that people are safe and cared for in an emergency, because often disabled people are left behind and forgotten in an emergency, and that is unacceptable.